Evening and welcome to yet another series of Health Talk initiative by Shrenik sir. We also have Shrenik sir here. Along with us, our eminent guest today is Dr. Jagdish Kothari, who is the surgical oncologist. He's got more than 25 years of experience in GI surgical oncology, and he's the first one to start robotic surgery in GI cancer in Gujarat. He is also a founding director of Aastha Oncology Associates, which is one of the largest surgical oncology group in the country. He is the founding director of HCG Cancer Center, which is in Ahmedabad. And he's received advanced training in GI and oncology in the US. And he's here to talk about what are the different methods and modern technologies which are involved in oncology today, especially robotic oncology. So thanks a lot, Dr. Kothari ji, for joining us today on this particular show. And I would request Shrenik sir to talk more about him, introduce him, because he knows him well for a very long time. So over to you, Shrenik sir.
Thank you, Ravi. Dr. Jagdish, warm, wonderful welcome, and it's always incredible pleasure meeting you, be it in person or you wanna meet online. And I truly love the way you are conversing with the people all around. And I just in the evening I mentioned to Ravi that Jagdish is absolutely soft spoken, down to earth, very precise, just like his expertise in robotic surgery. And yes, I am having a privilege of knowing him for last 25 years. And yes, I remember one thing when I was diagnosed with the cancer. Massive surgery was done in his clinic itself. He had told me one thing that Shrenik by next 25 years are all yours, and this is my 24th year. So I remember these words, and that is I remember every single day. And then with the grace of God, with the support from his colleague Dr. Kothari sir, I never had to look back. And the life is turning from our controlled cancer patient to survivor to winner to a global inspirational speaker. So sir, very warm welcome on our platform. Thank you so very much for your valued time.
Thank you, Shrenik Bhai, for those kind words. As you mentioned, the relationship goes on for last more than 25 years now, and we have always interacted in past, and you have shown so much of the confidence and the way you have you are living the life as a legend. And we don't use when we talk about cancer survivor. No, you are a winner. You are just a winner. And the humanity, some of the legends who have lived life like this, and you are one of them. So it's not in today's era that we are talking about a cure from cancers. Things are different today, and when we are talking about he was treated 25 years back, it was different then. And from that journey till date, it's a remarkable achievement that he has enjoyed. And Shrenik Bhai, best wishes to you and your family. And we want now on this platform, I pray to God that we need another 25 years. Ravi, thanks for the nice introduction, and I'll do my best to answer the whatever interactions that we are doing so that it would benefit whosoever is listening today or may listen it tomorrow. So I think I'm prepared for that.
Thank you, sir. Before we get started, I would like to request the audience that Shrenik sir has been, nominated for Vigo Health Award, and we would request more nominations from the audience. So he's been nominated for Patient Leader Hero, but Vigo Health. And if you can, do the few steps which we will share in the description later to nominate him, that would be of great help. So that I would get started with the questions with doctor here. So, sir, before we get on to the questions, it would be great. I mean, there are a lot of friends who are connected with this particular community. So, can we have a quick introduction from you about your journey, as a person, then as a doctor, and the specialty you've specialized in cancer. So if you can have a quick brief, then we'll get on to the questions.
So it's really very interesting that, as a dream of any parents back then in the 80s, I decided to become a doctor as a dream of my father to let it come true. And fortunately, with the best wishes from the friends, relatives, and blessings from Almighty, I did my entire training in medical sciences, MBBS, then MS and M.Ch. Everything I did from the prestigious college in Ahmedabad, BJ Medical College and Gujarat Cancer and Research Institute. So I passed my M.Ch in 1991. And since then, I have been practicing GI and Hepatobiliary Surgical Oncology. The last part which I would like to tell, what is motivating me even today to be in front of this camera is that, when we were getting trained for M.Ch, we used to read a lot of trials and the results from the best cancer institutes in the world. And at that point of time, we were impressed the way they had established their institution, what we call it as an institution and center of excellence for the treatment of cancer. And from that point onwards, we had a dream that we would some of the best cancer centers in the world. And the way they were practicing then and even today, the best cancer centers in the world would practice that people work under one roof, multidisciplinary team for the management of cancer is the best way to treat a cancer patient. So, that's how we started as two of us, as Shrenik Bhai alluded to, Dr. Kaustubh Patel as my partner. We started our journey in 1994 together out of a small nursing home. And today we are more than 25 cancer surgeons working under one roof and doing subspecialty and trying to treat our cancer in the best possible way.
Thank you, sir. Thanks a lot for this particular initiative. Really hats off. So the first question: you've been specializing in robotics in cancer surgery. So the first question is, do you really use robots, or is it like you getting replaced by a robot, and because that sounds scary also when you talk about robotic surgery and all that for a patient. If I'm coming to an institute and I somebody tells me, hey, it's going to be robotic surgery instead of a doctor who really feels the pain of the patient, it's going to be a robot which is going to treat you. So is it really involved? Are doctors getting replaced by robots, or are robots being used for precision?
Yeah, so Ravi, it's very important that only us who have probably not properly communicated, it is actually a robotic assisted surgery. So as on today, in the best centers in the world or even in the laboratory, every step is initiated by a surgeon. And surgeon takes the help of the computer or the robot and that's how it is translated. So it is helping me in doing my job in a particular way. And the way this robot is being used in surgery now, it is for more than 20 years that the first robotic surgery was done, and at that point of time the robot, and today it is the fourth generation of the robot that we are using. The machine is known as Da Vinci, and Da Vinci Xi is the model name. So this gives us a power in our hand, as if we are immersed within the body of the patient. That is the magnification, that is the 3D experience that we are getting while doing this surgery. So we are able to minutely see every small little structure in a magnification to the tune of 10. So 10x is the magnification that we have. And so that is the advantage, the movement that, it gives more movement than my actual wrist would allow me while doing my open surgery. So this is a 360-degree movement that we are. So it is known as wristed arm, completely wristed 360-degree arm, and 7 degree of different movements that you are getting while doing robotic surgery. So this is, the entrepreneur, the engineers, the scientists, they have created this brilliant, as you know, this is like a small startup. It started before 25 years in United States, and today it is a great company, more than $100 billion. And these people have worked so hard. It is so much research heavy, and has made these robots. And today there are about more than 6,500 robots installed across the world, and millions of surgeries are being carried out in different subspecialty of surgery. So I think wherein, and if I have to talk about this robotics further,
yes, sir.
What is engaging me, it has been now more than 5 years. We started in May 2016. My first case was done then. And of what is motivating me doing more and more robotic surgeries is the way outcome I get, the way the patients are benefited, the way I did open surgeries for 20 years before. Knew how patients were recovering out, and now this robotic surgeries for last 5 years in a given indications. Of course, I have to decide that who are the patients who are fit for robotic surgeries. Those who are fit for robotic surgeries, the way I have seen the results, the patients who are benefited, one of my patients was 94 years old lady. The family had come with a very, very clear cut, so to say, demand that, my mother has got this cancer and we would not like to visit the hospital again and again. And we kind of promised, there was a conversation between the family and us that, yes, we will try and deliver it in such a way that your mother is discharged out of hospital in 5 days, and then we will take care of her at the residence. And honestly, this lady did not have to visit our hospital after the discharge. So, now this is the benefit of the recovery after this robotic surgery, because they breathe well. And that's why less of the medical complications. We are worried generally in old age is the medical complications like lung complications.
True.
While these patients, because they have limited pain, they have no breathing problem, and they would recover well. So this is the motivation I have.
So you're saying this is a safer procedure with these tools. It is more effective, and people don't have to worry about this.
That's correct.
Yes, sir. You want to add on?
No, I think.
Yeah. So, sir, what is the difference between laparoscopic and robotic surgery? So, are there any connections, or are these completely different process?
Yeah. So most of the people would know about laparoscopic surgery, which was, I would say, invented before about 40 years, and it was mainly utilized for the appendicectomy and cholecystectomy, the gallstones problem, wherein keyhole surgery. In those days, it was the term was coined as a keyhole surgeries. So there was a specific set of instrument with limited mobility, and everything is handled at the bedside of a patient, where the surgeon and the assistant has to hold every. Talking about a very, I would say, the basic surgeries like cholecystectomy, appendicectomies, or hernias, which were being performed by the laparoscopic surgery. Then there are brilliant surgeons in the world who would always like to try new things, that they thought that if we are successfully doing these surgeries, and they were all also very excited, the way I was excited after doing robotic surgery, that my patients are recovering so well, why not try the next level of surgeries? So they started doing next level of complex surgeries like colectomy or hysterectomies, things like that. And they found certain challenges in terms of the successful completion of these surgeries, because you are talking about from about 1.5 hour surgeries to 3, 4, 5 hour surgeries. Now, you just imagine something which is made for 1.5 hours of surgery to be translated into 3, 4, 5 hours of surgery. So the challenges started coming. Now, brilliant surgeons, you give them 2 instruments in their hand, and they would do the surgery like an artist, and the patients would do extremely well. But now we are talking about a very large platform on which, the way I would say that the surgery, the instrumentation should be safer in the hands of a junior surgeon. That is what the best achievement of a base surgery or the base technology that you have achieved. So this is where the challenges started coming, that when junior surgeons were trying to do the surgeries with laparoscope, they were not able to accomplish this with laparoscopy. And those were the limitations of laparoscopic surgery, and that is how the robotic surgery is I would say, a modern version or the best of the laparoscopic surgery only, but much safer in the hands of a junior, a less trained colleague. And this is how I would, define between the two.
Yeah, I agree with you, sir. The technology has to really help the junior or upcoming surgeons. Otherwise, the senior surgeons who are like really experienced will get queued up. Patients will keep waiting for them, and with limited resources, limited highly skilled doctors, it will be very difficult. I think these tools should really scale up and help the volume of issues which senior doctor faces. Sir, the next question: what is the fiber optic endoscopy, and its importance, in the industry?
So this is we are going now. We talk about the way the surgeries are being done, and now we are going to say, for example, certain key important steps when you are treating or managing a cancer patient. So, the diagnosis is being performed. Say, for example, a cancer of the esophagus or the food pipe cancer, or a cancer of the stomach. Now, whenever patient has a symptom, you need to find out at which particular place of the food pipe the patient has got a cancer. So food pipe is a 25 centimeter long, and I want to find out for these 25 centimeters whether it is at a 10 centimeters, 15 centimeters, or a 20 centimeters. So my colleague, a competent gastroenterologist, will do an endoscopy. So he will pass the scope. That is what is known as a fiber optic endoscope, which can move inside the food pipe esophagus of the patient and would exactly find out where is the tumor. This is what my colleague helps me in proving a diagnosis of the esophagus, of the stomach, of the rectum or large intestine, which is colon. So upper GI endoscopy and lower GI endoscopy. Lower GI endoscopy will be useful for the diagnosis of the colon and rectal cancer, and upper GI for these cancers. And they would be exactly tell me where the cancer is, how long the segment is, and they'll take the piece from the tumor, and that's how I'll be able to find out whether the patient has got a cancer or not, and what type of cancers, because as you know that there are different types of cancers. So this is how I would exactly know that this is the cancer that the patient has. So this is one advantage of fiber optic endoscopy to do the diagnosis of GI cancer. Advantage of fiber optic cancer is beyond diagnosis. Once again, there are brilliant people in the world. Those who have found out, say for example, if there is an obstruction in the food pipe, a significant cancer involving the food pipe. Now my patient is not able to eat. They are able to swallow some liquids. Some patient in a very advanced condition, they would come and tell me that they are hardly able to take about 50 to 100 ml of liquid in a day, while my requirement that patient should take, if only liquid diet, 2.5 to 3 liters in a day. So there is a significant deficit, and how can, so that is the first thing. So these people have heard about the stent which is put into the heart vessels, the angioplasty, what is known as. So these people now put a stent inside the esophagus and make, once the patient has come, my gastroenterologist has done a diagnosis by doing an endoscopy. Now I need to find out that what is the stage of this cancer. And because this is how the entire treatment of cancer is tailored, depending upon the stage. As people know, there are 4 stages of the cancer. The earliest is stage 1 and the most advanced is stage 4. So once again, from the normal CT scan, which would do only anatomical mapping of the cancer inside the body, this has gone one step beyond the scan, and now we are talking about a molecular. So the diagnosis is done with the help of the PET scan plus CT scan. It's a fusion, what we call it as a PET CT scan. So it's a fusion between these two modalities, and the diagnosis is done at the molecular level. So in a typical language, when the patient or the PET scan, how it is different from CT scan. So I would just tell them in a simple terms that this will help us finding out the spread of cancer from head to toe. So this is the benefit of PET CT scan, which will stage the disease for my cancer patients, and based on that I'll be able to tailor the treatment for my patient.
Yeah, thank you, sir. Thank you for the detailed answers which you're giving, because it's very important for a common man to understand some of these procedures. So, what is the role of a multidisciplinary team in this entire process of treatment and surgery?
Ravi, in world over, it is now proven that when the cancer patient is treated in a discipline where all the doctors involved in the management are working under one roof, and take a joint decision. So, let me paint a simple scenario that there is a 35-year-old boy who has got a cancer in the colon, a large intestine, and has got a spread to the liver. Now, we are talking about a stage 4 cancer of the colon, and this patient will require a joint meeting between the radiologist, pathologist, surgeon, radiation oncologist, which is, radiotherapy is one part of the treatment. Medical oncologist who is a chemotherapist, the physiotherapist, the critical care specialist, the nutritionist, all these people would sit and have a discussion on a particular case which is being presented by one of the colleagues, and then we discuss stepwise that this is step for this. He would require a chemotherapy first. Thereafter, after 3 months of chemotherapy, he would once again go for the CT scan, and then he would be referred for the surgery, and then after surgery, he would require radiation therapy. Now, when all these things are done under, there is a complete cohesive management of a cancer patient. And in between also, we are talking about this treatment which would last for about 9 to 12 months. You imagine the treatment lasts for 9 to 12 months. So there is a constant interaction. Say for example, I take a lunch with my medical oncologist almost every day in the hospital. So, we would, during this lunch time, about half an hour, we would at least share some details. 5 patients are discussed, 1 or 2 details are discussed. This is how, the interaction occurs in a multidisciplinary team. So then I'm going to the operation theater, I'm going to the radiation oncology department for a coffee with my friend, and this constant interaction would occur. And it is now proven scientifically that patients treated by multidisciplinary team in a comprehensive cancer center, the outcome has been better. So outcome in every which way, not just the recovery, the survival advantage is also now proven. So this is the standard of care now at most of the base centers in the world.
Wow. That's a very good news, sir. But do all the cancer centers have this particular setup in the country, or is it only limited to this thing? Because the doctors keep moving, and there are very few centers like yours where everybody is connected and stick on to the role for a longer time.
Yeah, Ravi. So this is such an important question that you are alluding. Ultimately, as a society, we have to think about as a society and not the sector in which I work, and I'm proud of it that we treat the cancer patient in the best way. We as a society would like to see that lakhs of cancer patients are being diagnosed across the world every year, and they should receive the best kind of treatment. So thanks to now this teleradiology, telepathology, and interactions like this, this has started becoming so useful that some form of consultations between the experts are being done more and more frequently. Our meetings, right? We have virtual meetings which is occurring like this on various platforms. So same way, the consultations are happening more and more, and this is genuinely helping our patients. I reach out to one of the best colleagues wherever I have some doubt in my challenging case, that he is more experienced and he has treated patients before like this. I would reach out to him and he would generally give me his input, and that ultimately benefits our patients.
That's so nice, sir, because a lot of doctors who get into that stage of a lot of experience, they generally, due to ego issues, they hesitate. Even though they're not skilled, they hesitate to ask the other person for help because what they might think, and keep the benefit of the patients aside, and just go with what they wanted to do. But this is so nice of you. This raises a lot of I would say question to the entire nation's doctor, that is every doctor behaving the same way, where they keep their ego aside and reach out for help when they need it, and ensure that the patient is treated well the best way possible.
Ravi, I have about one thing, that my patient has to have a best outcome. And for that superego, I take care of the other smaller issues.
Good, sir. Thanks a lot. Sir, the last question before I hand over this to Shrenik sir. There are two category of people, patients who can afford, who look for, best of the surgery. They definitely need the multidisciplinary team, and to treat them, and they don't compromise. For them, cost is never an issue, and they want the best. They don't mind traveling to the best city where this is getting done. But there is another segment of patients who cannot afford. For them, all these things are good. They understand, but they feel that जहाँ सस्ते में होता है वहीं पे we should go in. So this is a very tricky and a very dicey situation for the patients who cannot afford it. For them, treatment चाहिए, सस्ता चाहिए, टिकाऊ चाहिए. So for those, what is your suggestion? I mean, keeping the organization aside, what is your suggestion for this particular situation for patients who cannot afford for these expensive procedures?
So Ravi, I really love to answer this question. What I would always say is this only. So, say for example, I'm trying to give, because I'm in Ahmedabad, I would say that, somebody who is in Surat, or somebody who is in Jamnagar, say for example. Jamnagar is about 400 kilometers from Ahmedabad. Now, a patient who is in Jamnagar needs a treatment. It is not correct that patient, every small little thing, he has to travel from Jamnagar to Ahmedabad. So it is very important that we must have more and more specialists who would go out and practice at various places. This is how the evolution occurs. And I mean, we are thankful to the visionaries in this country that now we are producing so many cancer specialists every year out of various universities. We are also now part of this training institute. We also have D&B program in our hospital. So we want them to go out. Now suppose if Ahmedabad produces 10 cancer surgeons every year. Now Ahmedabad already has about 100 cancer surgeons in a private practice. It cannot absorb every year 10 and 10 more cancer surgeons. So they have started moving out. Say, for example, Baroda to Surat and to Rajkot and to Bhavnagar. And this is how people have started going there. And we want that these are very, these kids, sorry to say that, but these kids are so smart. They are so well trained. So from the beginning, they have acquired certain skills and they do excellent job for the basic cancers that they are supposed to treat, taking care into their surrounding, that patients, they don't have to travel, as you rightly mentioned. That is where ultimately the treatment is given easy for them and most economical for them, and this is really happening, and I'm certain that in next about 10-15 years, of course it's a very long period of time, but in 10-15 years we'll have lot of cancer specialists in this country, and people will be able to get the treatment close to their home at a very, very affordable price.
Sure. Thanks a lot, sir. So Shrenik sir, over to you. You have anything to add on? Any questions from your side?
Well, Jagdish bhai, I must admire, and as I said earlier, you are always the best, in a flawless speaking. And I must, I heard, I listened the entire conversation. It was definitely easily understandable for all age groups, right from 20 years till age 85 or even 90. That is one thing. Number two, you know, uh, people can easily understand what exactly the robotic surgery is, what exactly the laparoscopy treatments are, PET scan and stuff like this. And then one more thing again I would like to add that neither Ravi nor myself, we are not doctors and we are not going to be doctors anymore in this life for sure. And therefore, I have conceptualized this e-HealthSeries, which is the first in the world as a vocal cord cancer survivor. We have done more than 19 episodes. I believe we got more than 35,000 views, and more and more are getting added. So the key purpose is inviting super specialists like you. And again, same, I mean, your time is precious, your priorities are totally different, and you cannot explain everything like what you explained today to every single patient or every single caregiver, because that is a problem of the time management. So whatever you explain, that is the best information, best knowledge available, and indirectly this can support patients and caregivers for taking timed decision and a right decision. So as I said earlier, we are trying to bridge the gap between patients, caregivers, and super specialists, so that and I always prefer. I mean, in all my life, like I prefer not to play shot in dark. Absolutely no. That is not the way how to lead the life, and that is the key purpose of streaming this online talk show and interviews. So thank you so very much for a very lucid conversation. I truly admire the explanation and knowledge sharing you did. Thank you so very much, sir.
Thank you, sir. Dr. Jagdish, it is an honor having you on the show. Uh, the importance of healthcare professionals have got, I think, got into limelight only during the pandemic. But before the pandemic, the I think the pandemic which has been here for a most higher tenure is cancer. And I think if we, as a government or as people, as individuals, if we would have focused on the discipline what we have focused as pandemic for cancer, I think we would have gone far ahead with this particular cancer pandemic. But I would really thank you and the team which got into this initiative of creating HCG Center as a team, a smaller team, and then slowly growing up. And also, I like your initiative of decentralizing and having more cancer institutes, so that people don't have to travel, people don't have to have unnecessary expenses, and don't ignore visiting doctor when they have issues. I think that is also being addressed with the decentralizing and the healthcare experts traveling and setting up their centers in smaller towns, so that they can help people out at the early stages. So thank you a lot, sir, for joining us on this particular show. And any message you want to pass on for the audience who are listening to this? Any precautions? What's your mantra for lifestyle, where जहाँ पे लोगों को मतलब they don't have to visit a cancer center?
Yeah. Ravi and Shrenik bhai, I think I must compliment that you are doing a great job in creating awareness for cancer. I think for such a long time you have taken a lot of pain, which is really admirable, and this is going to go a long way. So a great job. Message, yeah. So it's a very, very simple message that I would like to say is that do not ignore body signals. Whenever you find, any small little abnormal symptom or a finding, somebody, honestly speaking, just 2 days back in my outpatient, a 22-year-old boy had walked in and he said that he has got a bleeding with his stool. Now, this was going on when we inquired in detail. He said for 2 years. I just said to him and to his family only one thing, that blood in the stool is not a normal thing. This is always pathological and needs attention. So this is a very, very simple thing. It doesn't require any intellectual mind. Do not ignore body signals. Don't assume that I was traveling for last 6 months, or I had this problem, so for last 6 months I have got indigestion or things like that. You can have indigestion if you travel. You had great parties last week for a day or 2 or 3, but it cannot last for 6 months. So beyond a point, if there is a persistence of a simple symptoms, you must go to your basic doctor. I don't say that you need to go directly to a very, very super specialist. Go to your general practitioner, get yourself examined and being treated. If your doctor tells you that this is the medicine that you have to take, just forget it. Then it's over. Cancer is a very rare disease. So every now and then people are not going to get a cancer. But just go and take a basic advice from a doctor. Do not ignore body signals.
Sure, sir. Thank you. Thank you, sir. Thanks a lot for joining us on this particular show. Thanks a lot, Shrenik, sir, for initiating this particular thing where we are creating awareness to everybody who's watching and, getting doctors closer to patients, because during the pandemic, a lot of people are even hesitating to, go visit a doctor, and they're hiding a lot of things to themselves. So, yeah, friends who are watching this, do spread the word out. What Dr. Kothari has mentioned, that don't ignore, symptoms which your body is trying to say something, that there is something wrong. So if there's such situation, please do visit a doctor and consult them. Again, I would like to thank Dr. Kothari, Dr. Shrenik sir, for taking time out and spreading this awareness. Thank you, friends. Have a great evening. Thank you, sir. Thank you.
Okay, great evening. Thank you.
Thank you.